Dr. Mohita, I know as a neuroscientist, you've developed a program. So I was wondering if you could tell us a bit about how you deal with stigma or the self-stigma that your clients experience when they come and receive treatment from you.
Yeah, Mia, thank you for asking this question. Actually, before I answer a question, I would like to mention one point here, that everybody here sitting, and we as an individual in this earth are human beings. So being stigmatic about any kind of condition or any kind of time period in your life you're going through is really a torture to your own self. One should really understand that the time is not always the same. Sometimes you have, the time which is applauding you, sometimes the time which is just not good for you. So in due course of time, we all face some kind of depression, stress, anxiety. So we should really not be stigmatized about these kind of things. It happens to everyone, and irrespective of the gender, irrespective of the position one is holding, we are human beings first. So we should accept and we should self-respect our own selves. As Ashutosh has rightly mentioned, that it's just a body and we are here for a purpose. We are not immortal, right? So first of all, we have to challenge this concept of a stigma, especially, the concept of mental health. The Cognitome program that I'm offering is, of course, based on the concept of neuroplasticity or the neural plasticity, the synaptic plasticity, we call it as. There are two kinds of synaptic plasticity, the functional and the structural. So as Dr. Zaina mentioned about rewiring the connections, the neural connections. So there are multiple ways, that you can do it using the talk therapies and the psychotherapies as well. What I have been seeing in my clients, when I'm dealing basically with the anxiety clients and the PTSD clients. So when they come to me, they are specifically coming to me for their cognitive functions and cognitive control training because of either the prolonged effect of the usage of the drugs or, over anxious or oxidative stress in the brain and all those things, the perturbations in the HPXs and all that stuff. They have declining, they are suffering from a cognitive decline, kind of a cognitive decline or a brain fog. So I'm focusing and targeting on that. But I'm also a neuropsychologist. So having an empathetic approach towards the humanity in general, I definitely have some protocols to assess them and to know their initial stages when they come to me to evaluate them, to assess them, to evaluate them. What I come across, they are definitely, having stigma in their mind about, and they are not open to discuss to everybody when I seek a testimonial or something, being an entrepreneur. So they specifically ask me not to mention our names, just put the initials. Sometimes, as Mia was asking, I just wanted to mention here in the cultural context, specifically from India, the clients from India, they're very particular about not mentioning their name, not disclosing their name, not even mention the country. Though a lot of awareness campaigns and everything, psychoeducation programs, everywhere is going across, even in India. But, as a neuropsychologist, I personally believe, this is my personal opinion, that to deal with a client who are facing stigma, specifically the mental health related issues, one should focus on a person-centric, person-centered approach as well as having an empathetic attitude. So there are two ways the way I deal with the clients. One, I need to understand what a client expects from me. What he really wants is to be actively listened. He or she really seeks an environment which is safe for him. And me being a therapist or a psychologist or a psychotherapist or a neuropsychologist or a neuroscientist, me to whom he is coming to me, being very non-judgmental and non-discriminative about himself or herself. So this is what a client really expects. And they definitely want, of course, there are, some kind of ethical concerns and confidentiality confidential things that we have to keep secret about their identity and all those stuff. But still, what they expect is while seeking a treatment or any kind of therapy, they don't want us to be judgmental about their conditions. They don't want us to discriminate them that they are the patient, they are different from the crowd. Second thing that we must focus on is what approaches you can, you allow them, you teach them, you bring into their lives that they can come out of the stigma very nicely. So there are two important points. First, create an environment where they feel very confident, build a trust. Build a trust with them, understand them, be empathetic, be in their shoes, understand what is happening. Second thing, always, they also want that, they want that we should acknowledge that they are being stigmatized. So they want that self-advocacy, that, somebody has to, either they seek it from us, that you have to advocate from our point of view that, we are being stigmatized. So we really need to empower them. We need to, make them understand by educating and creating awareness, and ask them to go and seek the, social support or the peer groups, join those groups and share their stories. And don't be stigmatized about any condition, because because this is just a human life journey. And this is not permanent. Everything can be changed. And if you accept it, if you become self-aware about it, if you self-reflect about it, you're definitely going, overcome all these issues.
Okay, thank you.
Dr. Mohita Shrivastava is the Director and CEO of Cognitome. She's a renowned neuroscientist and neuropsychologist with a PhD in neurosciences from AIIMS, India, and research training from Kansas University Medical Center, USA, with 12 plus years of experience publishing articles and leading teaching and therapy programs. Congratulations, Doctor.
Hello, everyone. I'm very honored and delighted to receive this recognition by Health 2.0, and I would really like to thank Health 2.0 for recognizing the talents from across the globe who really want to make a difference and create a difference in the lives of the people. My Cognitome program aims to provide cognitive function and cognitive control training specially meant for the patients with PTSD and anxiety. And I've been doing this program from past 2 years, and it is giving very promising results across the globe. Thank you so much, Health 2.0, and I wish you all the very best in your all future endeavors. Thank you.
Thank you, Dr. Mohita, for your contributions.